Good afternoon, Hormies Brendan. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
Why did you choose OET?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
Your preparation time is over. Please start your OET speaking roleplay.
Mihiraa, I can see you're looking a little uncomfortable today. Before proceeding further, I'd like to take a moment to discuss your current wound status, particularly focusing on the pain you're experiencing today.
Yes, I am a bit uncomfortable. It seems like the pain is worse today, especially when you start touching the dressing.
I'm really sorry to hear that the pain is worse, Mihiraa. Let's talk about it. Can you tell me, on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain imaginable, what would you rate your pain right now?
Well, right now, with you about to start, it feels like a 6 or 7. It's not constant, no. It's mainly when I move my foot or when the dressing is being changed. It usually eases off after a while, but today it just feels more intense.
Thank you for sharing that, Mihiraa. Understanding your pain level is very important. Now, let's take a look at the wound itself. Looking at your wound now, I can see that it's looking quite good. There are no signs of infection like excessive redness, swelling, or warmth around the edges, which is a positive sign. The pain you're experiencing, while uncomfortable, is actually quite common and usual for an ulcer of this type, especially during dressing changes. This pain should gradually fade as the wound continues to heal and get smaller. Please continue taking your prescribed pain medication as you usually do. And do you have any other concerns about the wound itself, or any specific questions about the pain you're feeling?
I am taking the pain medication, but it is quite painful during the dressing change. Is regular wound dressing really necessary? It's quite disheartening.
I completely understand your worry, Mihiraa, and it's a valid concern. I want to emphasize why these daily wound dressings are so crucial for your foot ulcer. Because this is a deep and wide wound, consistent daily dressing changes are absolutely vital. This meticulous care is essential to prevent infection, which could lead to very serious complications. More importantly, regular dressing changes promote healthy tissue growth and healing, which is critical to avoid the need for more drastic measures, such as an amputation. Regarding the dressing change itself, the process involves a few key steps. First, I'll gently remove the old dressing, ensuring not to pull too hard. Then, I'll carefully clean the wound using a saline solution to wash away any debris or bacteria. Finally, I'll apply a fresh, sterile dressing to protect the wound and support healing. Does that make sense, Mihiraa?
Yes, it makes sense. I know it's important, but it's just so painful.
I hear you, Mihiraa, and I appreciate your understanding. Let's talk about some ways we can make this process more comfortable for you. There are a few strategies we can try. For instance, sometimes applying a cold pack to the area around the wound for a few minutes before we start the dressing change can help to numb the area a bit and reduce the sharp pain. Also, if you take your prescribed pain medication about 30 minutes before I arrive for your dressing, it might be more effective in managing the discomfort during the procedure. Another simple but effective tip is to elevate your foot when you're resting. This can help reduce swelling and, consequently, reduce pain. Do any of these suggestions sound like something you'd be willing to try, or do you have any other questions about managing the pain?
A cold pack before might be a good idea. I'll try that. I usually take the pain medicine when I feel the pain, not before. So, taking it beforehand could make a difference. Thank you.
You're most welcome, Mihiraa. It's worth trying to see if it helps. Lastly, it's really important for you to know when to seek further medical help. While some pain is normal, you should contact your GP immediately if you experience severe, unmanageable pain that isn't eased by your medication or the strategies we discussed. Also, be vigilant for any changes in the wound itself, such as noticing any pus, a foul smell, or an increased amount of discharge from the wound. These could be signs of an infection. Similarly, if you develop a fever or chills, these are also indicators that you should get checked by your doctor promptly. Do you feel clear about these warning signs?
Yes, I understand. I'll look out for those.
Excellent, Mihiraa. Thank you for listening so carefully. Now that we've covered everything, are you ready for me to proceed with your dressing change?
Yes, Ryan, I'm ready. Let's get it over with.
All right, Mihiraa. I'll be as gentle as possible.